Dorsal hand augmentation gains popularity in the aesthetic field. For a successful treatment, it is utmost important to have a good knowledge in anatomy, to use suitable filler material for this procedure, and basically and most importantly, use advanced techniques for this treatment. For the three-dimensional volume augmentation of the dorsal hand, calcium hydroxyapatite is a very suitable filler. Radius did prove its efficacy and safety in many studies on hand augmentation. Due to its physical and chemical properties, such as a high viscosity and a high elasticity, the volume efficacy is ideal. And secondly, due to its opaque structure, it camouflages very well the prominent veins. For the dorsal hand augmentation, radius is typically used in a mixture with local anesthetics. The approved and classical mixture for calcium hydroxyapatite is in a 20% ratio with the local anesthetic. The mixture ratio may vary up to the physician's needs. Radius for the augmentation of the dorsum of the hand is typically administered in two techniques, either the bolus technique using a sharp needle or the cannula technique using a blunt tip flexible cannula. The injection of the dorsum of the hand for a three-dimensional volume augmentation with radius shows an immediate improvement in volume on the short and the long term. Along the aging process of the dorsal hand, one can see that the dermis is thinning. Secondly, in this case, not as well visible, the dyschromia with lentiginous is appearing. And most importantly, from the filler aspect, is that we see a three-dimensional volume loss, which is visible here with the pronounced intrametacarpal spaces as well as with the prominent veins occurring over the long term. Prior to any treatment, disinfection of the to be treated area is crucial. The first technique we're showing on the right hand of the patient is the cannula technique. Therefore, the entry point, which is basically in the middle of the wrist, and in this case, as the patient has some bony alteration, a bit more distally. Secondly, the hole maker for the later cannula treatment is placed. A tip is to tunnel the way of the cannula, the direction we will navigate her later. We are treating with a TSK cannula in this case, which is a blunt tip, flexible, 2 centimeter long, 25 gauge cannula. Two remarks regarding the cannula. I'm pointing the tip and the hole down, which can be controlled by the hub marking. The hub marking controls the tip location of the hole in the tip of the cannula. And secondly, it's important to tell that we have to prime the cannula. In this case, we can see the little dot of the radius coming out at the tip. We now insert the blunt tip cannula and let it glide in the intermediate lamina of the dorsum of the hand and injecting the filler, calcium hydroxyapatite, in a retrograde way. Every intermetacarpal space is going to be filled in the same way. Every thread contains approximately 0.2 milliliters, 0.2 cc of the filler. In this case, I need 2 threads in her first space and even 1 more medially. And now I'm redirecting my cannula to basically fill every of those spaces. I can reach, even in a large hand, I can reach every area I want to fill with this long cannula and with this technique. Most importantly, the filler has to be molded after the treatment in order to guarantee an even distribution of the material. We showed the cannula technique in the right hand of our patient. I did inject calcium hydroxylapatite in a 20% ratio mixture with lidocaine 1%, and I used 1.3 cc. The treatment of the volume loss of the dorsum of the hand with radius gives an immediate, subtle and smooth three-dimensional volume augmentation on the short and the long term.